During the procedure, we do use local anesthetic, such as lidocaine, to numb the area to hopefully prevent pain in the first short period of time after surgery. Afterwards, the best thing for pain and swelling after surgery like this is to take Tylenol and ibuprofen. These two medications can be alternated, so you can take one of these every 3 to 4 hours, alternating between the two. We will also prescribe you with a stronger narcotic pain medication that you can take if needed for any breakthrough pain. Following the procedure, we will have a dressing and a wrap around the penis and the scrotum. And this is in place to help reduce swelling of the scrotum and help reduce swelling of the penis. The only thing that you can do to reduce swelling is to really just take it easy those first few days. Do not do any heavy walking, do not do any heavy lifting. Just really take it easy for those first 2 days. The incision site is actually very, very easy to take care of. We will have a dressing on the penis and the scrotum. That will come down 2 days after surgery at home. You can do this in the shower to help release some of that adhesive from the tape. After these dressings come off, you do not need to do anything to the incision itself. We don't want you to put any ointments or any creams on the incision. After this time, you're able to shower. You can let soap and water run over the incision. Just do not scrub the incision really hard in the shower. With the technique we use to place the penile implant and to place the pump in the scrotum, there is no need to pull down on the pump following surgery. This is great because it prevents soreness, it prevents you from having to deal with it, so there is no need to pull down on the pump inside of your scrotum. At the time of your surgery, and especially post-operatively, we definitely recommend you start taking a medication called Docusate, and that is an over-the-counter medication for constipation. It is really just a stool softener. It's not a true laxative, so it won't give you diarrhea, but it will help to keep you regular after surgery, especially because some of the pain medications you're on can cause constipation. There are some restrictions following surgery for that first 6 weeks while you're completely healing. There are restrictions to lifting. We don't want you lifting anything really over 15 or 20 pounds for that first at least 4 weeks to 6 weeks. We do not want you soaking in water for that first 4 weeks either. So that means no swimming pools, no bathtubs. Showering is completely fine. We just don't want you to be soaking in water for long times. The other thing we don't want you to do is things like riding a bike, riding a motorcycle, nothing that's going to put pressure on the scrotum or the genital area for those first 4 to 6 weeks. We recommend patients wait to drive until they're not taking pain medication any longer. We don't want you driving while you're on pain medication. The other thing is we want you to be able to slam on the brakes comfortably in case you need to without hesitating because of pain. That's usually within about 1 to 2 weeks after surgery. Returning to work completely depends on what you do for your job. Usually with light desk jobs, after a week or two, you're okay to return to work. It may be a little bit longer if you're doing a lot of physical activity, but remember, we will want you on light duty for at least a few weeks following the surgery. We expect the majority of your recovery to happen within the first 1 to 2 weeks after surgery. This is the time when the pain is going to get better every single day and hopefully be minimal by the end of this 1 to 2 week period. However, the full recovery takes about 6 weeks. At that 6 week mark is when we will give you the green light to have intercourse and to teach you how to use the device. We do not want you to hesitate to call our office for any complication or anything that concerns you after the surgery. The main things to look out for are increased swelling, any kind of pus that's draining out of the incision, any fevers or severe chills, or any kind of severe pain either in the abdomen or in the scrotum. Those are the main things that we want you to call us immediately. Following the surgery, we will want to see you in 6 weeks. At that visit, we will teach you how to use the device and most likely give you the all clear to use the device and have no restrictions from that point on. Now, if within the first 6 weeks after surgery you have any concerns or questions, please do not hesitate to call the office and make a sooner appointment. We will gladly see you at that time. After the 6-week visit, we will usually see you in 6 months just to make sure that everything is still going okay and that you're doing great after your surgery. We expect the majority of our patients to use the device after their 6-week follow-up appointment. There are some patients who feel ready after 4 or 5 weeks. And if you feel ready after 4 to 5 weeks and you want to come in a week or two sooner, we can make that happen. And if everything looks good, we can give you the all clear at that time. But the average time is about 6 weeks after surgery. After the surgery, during your recovery, or any time following the surgery, if you ever have any questions or concerns about the surgery or the penile implant, please do not hesitate to call our office. If they have a question that they can't answer directly, they will reach out to me and I will give you a call back as soon as I possibly can.